morning. It is July 13th, 2026. It is 7:31 p.m. and we will start the Board of Health meeting for the town of Fairfield. We'll start with just approving last month's minutes.
Motion to approve the minutes.
Okay. Do we have a second?
I second.
Okay. Any opposed? All right. Hearing none, they pass. We'll move into our reports.
Sure. So this past month, we did the sort of annual meeting with the Fairfield Beach Residents Association, with the First Selectman's Office, the Police Department, the Fire Department, to kind of review what happened last year, to look at the issues that they continue to experience. You know, the issues they brought up were overcrowding, loud parties, large parties, speeding on the road. And so we discussed, this was requested by them to talk about alternative approaches, and so they're potentially going to be looking at, or they researched like different ordinances other college towns have, and they're going to be looking at sort of public nuisance or gathering nuisances or those types of things that other towns have put in. I don't know the effectiveness of them. They seem to say that they've curbed a lot of those issues, so they'll be looking into that. We did one of the things that took up a lot of time this past month is a noise nuisance. ShopRite has expanded into the Party City space, and in doing so, they found some outdated electrical equipment that had to be upgraded, significant electrical equipment, transformers and things like that. And so they were inside the building, had to be relocated to outside the building. So they had to go on generator power for a couple weeks. And the generator they put in place was extremely loud, 85 to 90 decibels constant. And the backside of ShopRite backs up right against a residential neighborhood with condos. It's them, a fence, a driveway, and condos right there. And if you stand on the steps of the condos, you can feel the vibrations of the generator. And so we worked with ShopRite to put in additional sound deadening. They moved the generator behind put an 18-wheeler in front of it, and then constructed sound barriers under it and around the ends, trying to deaden the sound, which the first couple attempts did not really do it. Then they, constructed some, 25-foot high walls and things around it and draped some deadening blankets, and that made it tolerable. And so then we began working on trying to shorten the time that this was going to go on. It was expected to go to July 10th, and so we had the fire chief was able to reach out to UI and persuade them to hire a crew at the expense of ShopRite to come on the weekend. It was July 3rd, 4th, 5th weekend, and we were able to expedite some inspections from the building department several days, and so building department cleared it, and then the storm happened on Saturday, and power outage everywhere. They pulled the crew, and so they did not get the generator off on Monday as they had hoped, but they were able to get it off on Wednesday night. So we're 2 days prior to what they expected, but it was just a significant amount of time, multiple inspectors going out, measuring the sound and just talking to neighbors and updating the First Selectman's Office and the others involved. And so just a bit of effort for everybody involved. At the same time, we have inspectors going and inspecting the new portion of ShopRite to clear it to open, and so they're, beautiful new additions there, so it'll be...
Was it very hot? Was it way over the limit, the noise limit, or whatever the decibel?
So, we don't enforce the noise ordinance, but my understanding is that, yes, it exceeded it, but really what the police go on and what they've kind of defaulted to is it unreasonable? And everybody said yes. Yes. It's an totally unreasonable noise. You got to do something.
Yeah.
So they took steps, and they kept trying until something achieved some reduction. We got about a 10 to 15 decibel reduction on average, which seemed to make the neighbors happier. I won't say happy, but happier. They were able to sleep through the night, like
Yeah.
they said, it was waking them up, and the vibrations were, just driving them crazy. We did, this past month, have a meeting with the selectwoman to talk about departmental goals and do a review of that. And so just to sort of summarize what we talked about, we are looking to, we've talked about it here, implement a new strategic plan. We've met with a consultant. She gave us a proposal. We're sort of looking at considering other proposals. We're seeking something a little different. And so we'll continue to work on that. And then we are in the process, as I've mentioned many times, of migrating to a new database. We continue to work on that, and over the next year, we'll be migrating to, hopefully, a new nursing database. Well, the schools database, Infinite Campus, is going away, so that's who we use as our EHR right now, and so we'll transition to, hopefully what is a better program that provides, a lot of different improvements, and so that's something that we're looking to get an answer soon, now that we're in the new fiscal year, and try and implement it so we can train this year and launch next summer and, have it in place for next school year. So that's sort of one of the things on our list. And then we're looking to use, in our new payroll software called Paycom, they have a functionality that allows you to post policies, and have an employee go in and review that policy and confirm that they read it. And so we're looking to roll that out in a more substantial way this year. We still have to be trained on that. We talked about some additional goals that we're working on, in terms of, I've talked about the opioid planning group that I'm working on, so that's, there's two of us, Santina and myself, working on that group. There's the Fairfield Safe Streets Alliance and Fairfield Safety Action Plan that's in play right now. And so we're looking to, we're continuing to be involved in that. We did submit so what happened there is we, moved forward to get a proposal from Fairfield U to get a needs assessment for the community related to opioids, and we received that proposal, had the town attorney review it, or asked him to review it. He referred us to another attorney because his firm works with Fairfield U, but he advised that we need to take. So the town has received the money already, but we need to have all three boards appropriate the money. And so we have to go. I did go before the Board of Selectmen. They approved the funds. Now I have to go to Board of Finance and RTM to be able to authorize the first select person to sign contracts and agreements. And so before we can enter into any kind of agreement with Fairfield U, we need to have that approval in place, which will add another month.
You're going to have to do that every time you get money added to that?
So what we're trying to do is we've done it for all the funds received to date.
Right.
And so that we're not saying we're spending X on this. We're saying this is the funds, we're going to use it in accordance with the agreement. There's the Exhibit E, which says this is what you can use the funds for, and that's it.
Right.
And so just say we're going to use these funds to do these activities, and so that's the plan. But hopefully we get it all approved, and that's okay. And then, so with the Safe Streets Alliance, we continue to work. We actually, the health department submitted what's called a microtransportation grant for application for $5,000, and it was awarded. But I have to go through the same process to get that award appropriated with all three boards. So luckily, I can team it up with two of the ones that I have to do, and then I just have to go to one additional Board of Select Persons meeting to get that approved. But we hope to have that approved and be able to buy stuff. We have an event August 4th, Fairfield Night Out, the police department is sponsored, which the flashing lights that I think we brought one time, I don't know, did I bring those to one meeting?
I think last month, yeah.
Yeah, okay, so that we have planned to distribute those there, and that's, and in addition to educational content. But that's, so we're going to add to that. This grant was for $5,000 worth of reflective items, and so we've got spoke reflectors, and so we've got a bunch of ideas of potentially spoke design contests and the like to get people more visible at night is the hope. And so, I have another page here. So we continue to monitor the large-scale outbreaks that are going on throughout the nation, throughout the world, and participate in multiple calls with CDC and Connecticut DPH. The Ebola outbreak in Democratic Republic of the Congo and Uganda is up to 1,904 cases. It's now, and 704 deaths. It's now the third largest outbreak of Ebola ever. While we have no cases in the U.S., we do now have one U.S. citizen that was a NGO worker in DRC that was tested positive and is now hospitalized in Europe, was moved out of the area. The measles now is up to 2,218 cases in 2026. The sum total of all the cases in 25 was 2,285, so we're close. In 6 months, we're close to what we did all last year. It's now in 42 different jurisdictions, including 2 cases in Connecticut so far. And then there's a cyclosporiasis outbreak going on with 1,608 U.S. cases in 34 different states. And the tricky part of that one is that there's no sources identified yet, so it's sort of very general educational content of, wash all your produce and cook it if you can, and, be careful, and so, we're looking at posting some content of, risk-based. If you're at high risk, meaning these categories, you should probably take some extra precautions to avoid that. The hantavirus outbreak in the U.S., the quarantine period for all the U.S. citizens who came back from the ship the last quarantine period ended on June 21st with no U.S. cases. There were some 18, I think it was 18 total that went to the Nebraska quarantine facility. I think there was 9 left at the end, with several going home, being monitored by local health departments. We've had a couple closures at the beaches. On June 22nd, we closed Lake Mohegan due to rainfall and reopened it in one day. We closed all the beaches, all the swimming areas last week due to significant rainfall, resampled, and all the samples came back acceptable except for Lake Mohegan. We extended that closure and resampled, and those resamples came back fine, and we reopened that a few days later. So we've been working on posting various content on social media this past month with things like summer food prep tips and extreme heat, a couple of different extreme heat posts, some measles notices, and some posts on now's the time to check your vaccine records to see if you're immune, if you don't know, and before you get involved in an outbreak. Also, ones on swimming area closures. We have a couple. Drain and dry before they fly is mosquito prevention content, and don't be a mosquito maintainer. Just tip your container. One which I thought the staff came up with was clever. Content about submitting your physical forms to school nurses for Fairfield Public School, some about infant botulism recall, and the Safe Streets for All public forums that they're holding over this summer, trying to get people to go to those. The staff participated in a emergency preparedness in-house in-service, where we had our preparedness staff review the different plans we have. We have a lot of new staff that are not as familiar with the preparedness plan, so we had them review those. Sarah, you did a bloodborne pathogen, right?
Julie did it, yeah.
Julie did it, and so we did also some fit testing was offered to the staff.
Used fire extinguishers.
And we did. We were able to arrange a fire extinguisher training for the staff.
You have the fun little demo set up there, we can do it,
Yeah.
Yep.
A little scary, yeah.
And with real fire, right?
Yeah.
Yep. And
Real fire.
Yeah.
yep.
Oh, wow.
And the staff, we have these large bags, and that we typically have the staff in the back of the car with a hard hat, gloves, eye protection, ear protection, booties, and a variety of different things in there. And so we brought those all down and made sure they were all restocked with, that they had everything they needed. And then I'll ask Sarah. I actually was going there that day, was getting things set up, and then I just felt awful, and so I went home. And but the staff went. So any comments on that day?
I really liked it. I'm one of the newer people who didn't know about all of the emergency preparedness plans and all that, hard work that they put into putting them all together. So I liked it.
Good.
Yeah.
You were there,
I
right?
was there for half the time, because Patty called out, so I
Oh,
got
that's
called
right.
back to the real office.
Okay. All right. Well,
Yeah.
and then the Region 1 conducted a large-scale Family Assistance Center tabletop exercise at Stratford Health Department. So a few staff participated in that. They're just sort of going over, large-scale emergency events involving it's not a reunification, but it's a notification of status of impacted individuals. So, if you've lost contact in a large-scale event with someone you love, or you don't know the status, or you don't know what hospital they're at, that's the type of thing that we would set up this type of center to sort of advise them. A lot of good content, a lot of learning about, the people that we don't know are the people at the hospital who maintain the list of who's there, and that we need to, and apparently there's I forget what they call the name, omnibudsman or something like that keeps track of, patients coming from different locations and, who's at their hospital that can provide that to us. And so just some good lessons learned about that. And then that is my report for today.
Question, has there been any conversation, and this isn't maybe entirely health department related, but it's life safety, the reef and the fishermen out there that continue to get swept away? Right, I mean, this is a recurrent issue. I mean,
Yeah.
in fact, I've been out there multiple times for recoveries and rescues, I mean, it happens too often, right? I mean, even once every couple of years, I think it's too often.
Yeah.
I mean, there's a sign out there, don't go out there, watch the tide, whatever, but clearly it's not working.
Yeah.
I mean, has there been any conversation about that to make that safer?
I'm sure that's going on. I've heard some talk about it when that event happens. But I haven't been a part of those sort of conversations. I know we've, similar to Lake Mohegan, we've posted signs and, tried to do, what is the sort of common tactics to try and reduce the risk of those types of events. It's the same thing happens in Milford at Silver Sands, and I know they have so I'm not sure what the approach here. I know in Silver Sands they have somebody walk out and scoot everybody off the island and say it's time to get off now. And they've actually started closing that island, Charles Island, for certain points of the year to say it's just a bird sanctuary now, so nobody can go out there. So, but I haven't been a part of those conversations.
Do you get, does the health department get complaints about Lake Mohegan, or is that just the police and fire?
Regarding swimming?
Yeah, in the Cascades where it's no swimming.
No, that would be a police
Yeah.
issue, to scoot them out of there. We get questions about water quality and things like
Yeah.
that, and, why does the lake close more frequently.
It's gotten really bad. I mean, I go there a lot, and I think there must be some, just like 40, 50 people coming from out of town and picnicking and barbecuing, 8 loads, like garbage, like crazy amounts of garbage that DPW probably has to come and dispose of. They did add extra garbage cans, but huge stereos, speakers, grills, like they come, and if you look at the cars parked on that road, a lot of them are even New York State plates. So I think there must have been something written up about it, like if you want a free watering hole.
Like a secret.
Yeah, that has now sort of, because in the last like 4 or 5 years, it has changed incredibly.
And anytime there's like the heat wave that we had.
Yeah,
you
it's
know,
just a
it's
place
just-
to go
people
and,
go and
yeah.
they're just,
I mean, whatever, the garbage and the crowds is one thing, it's the swimming that scares me.
yeah, no, that's,
You see kids swimming and I'm like, do they know how to swim, or, you know?
Yeah, they have no idea how deep it actually is.
And there's
They
a,
don't know
that's
it's
a
all pouring.
weird, I don't know if you guys have been there, but it's not like it's very sort of rocky and different depths and,
slippery and, yeah. And,
Yeah.
and people, there's, elevations that people jump from
Yeah.
that, you know, depending on the water flow, you know, is
Yeah.
you're diving into various different depths.
Shallower or deeper.
yeah, and there's been deaths there.
Yeah, no, that's a constant, I think, for our police and fire.
Yeah,
They're always
yeah.
responding there, and
Yeah.
conservation maintains it, so I'm sure that they're fielding complaints about
Yeah,
that kind of activity.
yeah. But there are
Are
signs.
there I mean, I think swimming is an equity access issue. Are there low-cost places for people in town or nearby where people can learn how to swim?
So the rec department has swimming lessons at Lake Mohegan,
Mm-hmm.
and I believe they do it at Jennings Beach as well.
Yeah.
And so those are more affordable options, you know, at those locations, but I'm not sure. We were looking at a grant, a drowning prevention grant that we were considering applying for, and so, but we just kind of got tied up with a bunch of stuff this month. And so, and we, you know, wanted to do this microtransportation grant. But we were considering that, you know, because we did have that drowning in a pool a couple years ago, and so, but yeah, the town offers more affordable swimming lessons through the rec department.
My other question on safe roads, we continue to see incidents with scooters and e-bikes happening around town. Any larger focus on that? Was anything actual kind of coming up to really try to educate or prohibit or just do something about this?
So the Fairfield Safe Streets Alliance is looking at a couple different approaches. And so one of them is, and what it'll probably start out is a voluntary certification program to try and encourage parents to, if you're going to, you know, we talked to the school about having it required to drive your e-bike or e-scooter to school, you have to have this certificate, but it comes down to it's another program that has to be managed and people being told you can't do it and you have to have a sticker for your bike or your scooter if you pass the test kind of thing. And it was a management issue that the schools weren't willing to take on. I shouldn't say weren't willing, but it was like, you know, they liked the idea, but it was, they needed to find an efficient way to do it. And so what we're looking at is a student from New Canaan took on creating an online certification course. It's, you know, basically you watch a series of videos and you take an exam, and when you're done, it gives you an email that says you passed the exam and you're, you know, certification as a, you know, e-bike rider. And so we're looking to promote that for parents to say, you know, if you buy your child one of these devices, that, you know, at least have them take this. I mean, kids who are 16 and older they're starting to get their driver's license, they go through training programs, they learn about the rules of the road, but younger than that, you know, as everybody notices, and it's a constant, almost at every meeting we talk about e-bikes and e-scooters and the behavior. And so one is to talk to parents about, you know, require your kid to, one, wear a helmet, and two, take this program and learn the rules of the road, you know, drive on the right side of the road, you know, the correct side of the road, I should say, you know, and, but there's also the police is working with the RTM to write an ordinance that allows anytime there's an accident involving a child on an e-scooter, e-bike, it gives the police the authority to fine the parents for that. And so that has been used in other jurisdictions and seems to be in a more effective way. And so they're looking into that. The police definitely struggle with it because they simply
They can't do anything.
they can't engage in chasing them, for fear of, accidents and making it worse. And they don't want to be detaining children, and, in any way. And so it's a struggle for them as well and for everybody. We all see it. Kids blowing through stop signs, kids, doing wheelies down the middle of the street, kids doing also, I shouldn't say it's just kids, but it's also, young adults are doing this stuff in different areas as well, occasionally. But so it's a struggle. The Safe Streets is looking to do that. It's looking to, the traffic cameras are part of that, trying to get people to slow down in school areas. At the Fairfield Beach residents meeting, they requested if they could have a speed camera ticketing thing on Fairfield Beach Road. And so they're looking into whether, only certain types of situations qualify. And so for that, and so they're going to at least look into it and see if it's even possible, if the state will approve that. But yeah, it's a discussion in almost every meeting we have.
Any other questions for Sam? Well, Luke, having an agenda, I'm going to assume, Sarah, you have something to talk about.
I'm next, yeah. Well, it's July, so I'm obviously looking back at the year that we just finished and then planning for the next year. Starting with staffing, we had an opening at one of the elementary schools. I'm so excited we filled that with a sub who just started subbing with us this year and left school nursing and not working on the weekends and left the hospital for us. But we have to hire new subs. And I also, we converted the 2 part-time positions at Tomlinson into a full-time one. And one of those part-time nurses is taking the full-time. The other one I already knew was resigning this year, getting her NP, so it was win-win-win for that one. I hired 3 new subs who were orienting at the very beginning of the year. So I was excited that we were fully staffed until about 5 days ago. And so we got a request to staff 15 hours a week at one of the private schools. That's what we do at the others, but the school has been paying for their own. So I have that opening right now, but otherwise I feel we're in pretty good shape for how early in July it still feels like it is for next year. I also spent a lot of time looking at, so the nurses do statistics every month on all these different data points, and I had some thoughts on the stats last year, but I thought I was too new, so I kept it exactly the same way it was, and then this year I'm really digging through what is definitely not being filled out consistently, so people are counting a meeting different than other people. Did you leave the office for the meeting? Did you have a conversation for a meeting? Communications with parents, all of those things, but some good numbers for you guys. So we finished the year. We have 40 full and part-time nurses. We cover the 27 schools in Fairfield, so it's almost 12,000 students. We had a whopping 106,164 nurse visits this year across those schools. That works out to be about 587 visits a day, by the students. The average student in Fairfield came to the nurse 9 times. I just always point out that stat because people like to say, my kid never goes to the nurse. Now, it's much higher at
My kid was one of those kids.
Yeah, never. The average is much lower at the high schools. Those tend to be the kids with chronic conditions. At the elementary schools, it can be as high as 17 visits per student. I just think that's interesting. Trying to find which data points help besides those health office visits, though, has really been where I've been kind of digging in. That's my big project I'm so excited for tomorrow. I really am, because it's been fun looking at all this data, but also when you look at it and you say, well, what are they possibly counting? If we do emergency drills, for example, when the nurse runs them, that's what we're measuring, and that hopefully is 2 per year for every school. Some had 14. I was like, they did not do 14. They counted fires. So trying to really write up something that we're all keeping the same things. But the nurses administered 15,887 medications. That has a significant increase you can see year after year. In the last 4 years, it's kind of a straight line of how many kids are taking meds while at school. That amounted to 2,011 students with med orders at school. We have mandated screenings we do every year, so there were 4,656 vision screenings. I can email you all this, it's okay. 4,817 hearing screenings, 964 postural screenings. So that's been kind of fun looking at all that data and trying to see which points really matter. The statistics that the nurses fill out has gotten so long, it almost feels like at the end you should be like, Days, you did statistic, like it's just one more task, so trying to get that number down a little bit. This spring, we precepted 9 nursing students. They were finishing at Sacred Heart, their public health rotation. That's always a fun one for both the nurses and then the students coming through. And then I was just kind of trying to write up and look at what we accomplished this year. So last summer, when we were planning for this year, but this year we completely redesigned the onboarding and orientation process for all the nurses. I love it. I think it's really good. The state is actually, the Connecticut State Nurse Association is looking at the one that they put on, and they've been looking at some of our stuff too. We also created a new orientation that was just for the substitute nurses. Historically, they were all trained the same, and there's a lot of stuff like care plans and things that you're never going to do as a sub, but then there's also like, what do you do when you walk into school and you don't know anyone? So we've made 2 separate trainings. I reviewed and then I updated the way that the nurses were doing their annual review. Their contract requires an annual review every year, up until 5 years. So I personally did 21 of those 40 nurses, a review. And then another thing I added this year was kind of a personal thing that I like. I had all of the nurses create 2 goals for next year. I think, especially whether you've been here 2 years or 20 years, it's always good to sort of think what you want to do. And for me, it was really, really enlightening going through them all. There were some themes that are helping me think of continuing ed for next year, like number of nurses wanted to personally spend more time studying mental health, talking to kids in crisis, some of those. Quite a few have had a goal of being nationally certified as a school nurse, which is something that I think is really important, so I'm happy to see that. This past year, we implemented a new continuing education plan that had those online programs that the health department purchased. That has been really good. I've got some great feedback from that, and we have it through October, so then we'll sort of decide, do we need the full 10 package, or is there other ways to do it? And then we reviewed and clarified several different policies and practices. We're trying to really work towards this practice standardization across the department. One of the things that I'm working on this summer for next year is having all like a sort of a standardized checklist of how each office should be, giving it to all the nurses, so they know exactly what we're looking for, having them do that within their own office at the beginning of the year, and then having myself and the coordinators do it twice during the year also, just because there are 27 schools, and sometimes the one that you don't ever hear from is the nurse who's really like drowning and needs some education and some help, and you don't even know. So that's the big stuff. It's a kind of quiet moment in July where not every, we have the ESY, the Extended School Year program going on, but we also have time to really look and plan, and I like that stuff, so it's a good month for me. That's it.
Do your nurses use any of this data to sort of inform what they are looking towards next year?
Well, sadly, the number that is the most helpful is always the health office visits, even though we look at everything else. And the area that we used it last year, and I saw some impact this year, it was the schools that have just a lot of unnecessary visits. I shouldn't say unnecessary, non-medical. They might have needed to leave the classroom for a reason, but it wasn't really a reason that needed to go to the nurse. With this constant increase in kids with chronic illnesses, kids needing medications at school, like the nurses are busy as it is, and so eliminating the my clothes are dirty or, those kind of things. In some ways, it doesn't always give you the full picture that you want. Like high school nurses, if you look at it, just the office visits, they don't look that busy, and then you look and see that they went to like 22 504 and IEP meetings that week, and you're like, that's 30-hour week in its own. But I've been trying in that to figure out how to use that data in a way that helps them. And also helps kind of quantify all that work that they do that's outside of the
Yeah.
visits. Does that make sense?
Yeah,
Yeah.
absolutely. That's great.
Does the town financially support the nurses seeking their certification? Does it incentivize?
In their, yep, it's in their union contract, and I don't know how much it's always known about, or actually, this is the first year, this contract that started almost when I started, is the
Well, but
first-
they've always had
a bucket,
$500
yes.
of educational funding available to them to take courses, to buy textbooks, to, you know, that's been a constant.
Yeah.
They've added on to that now where
Right.
it's, if you get the school nursing certification, you get
A stipend.
a
yeah.
stipend.
So now they still have that $500, and then they get this stipend.
Yeah, so
if
now
they're
the
certified.
benefit has gone up to almost $1,100 in different, you know, if they get certain certifications and specialty, like, was it a diabetes educator?
Yeah,
You get a stipend,
it's tough.
and we've added the continuing ed
Yeah.
online courses for them, so.
Yep, there's certain components that you have to meet to even be able to take the test, and then, I think it's like $300 when you go to take it the first time, so I think without the
And adds
reimbursement,
up,
you're kinda
yeah.
like, well, who needs that? And then you have to take a lot of continuing ed to keep
Right,
it
so if
up.
you pay for the courses to begin with, you probably exceeded that 500.
Yes,
Maybe just to incentivize it a bit more, thinking if you're gonna do this specifically, probably like the exam fee in addition to your
yeah,
allowance or something, it's a one-time fee, right? So.
yeah,
Yeah, the 500
Contract, but-
amount has very general
right,
language there. It can pretty much cover anything that Sarah approves,
yeah.
for the most part.
Yeah, but I'm happy to see the increased interest in it,
Yeah,
'cause
absolutely.
I know, personally, I've always been in my whatever, I've been working in field certified, but, I think it's good. I think it's good to see what the whole world's doing, you know, how different school nursing is, the issues across it,
Get outside of your bubble and
yeah.
broaden your horizons a bit.
And it is just kind of a unique little weird field that hasn't been around, you know, about 100 years. They started putting nurses in schools, it's not been that long, and so feeling it more as a professional organization and a little less of just like the job, you know, you go to. So,
Well, what did you, I missed it, you said that there's Fairfield school nurses in private schools?
mhm.
Is that, we just do that, or like, what is
Yeah.
that?
So the law that they refer to is always like services, so that's the same with like busing and same with, so if we provide services to the, public schools, then we provide it to the private schools. The issue becomes the private schools are often so much smaller, or, don't have some of the things, you know, they can select their students, where the public school obviously has to
Right.
take everybody.
Right.
Some schools we provide, you know, over the time, over the, you know, history of school nursing here in Fairfield, we've provided schools with 0 hours
Mhm.
and just had somebody go and check to make sure their physicals are done and their vaccination
Screenings and those
records and
things.
screening, so they just,
Train people
the
on
coordinators
how
will go and like cover that school a couple times a year, and then up until, you know, some schools, you know, Notre Dame Prep, we provide full-time nursing, you know, so it's.
We have 2 schools in the town that don't have a nurse, that have, you know, Walter Fitz doesn't have somebody there, and
Yeah.
Covenant's very small, those are very small, so we manage that as the coordinators and myself.
So schools like Fairfield Prep don't have their own nurses. It's provided
School, yeah.
by the.
We provide
By
the
the
school
town.
nurse, yeah.
Yeah.
Based upon the population, you know, so we
Right.
generally use a, you know, ratio of the population to say how many hours are you gonna get. And it depends on the
Like I say, or they
acuity of the students, because like Covenant had full-time nursing coverage.
20-something kids, because of the student that
Because
had
one student,
non-delegatable nursing
you know.
tasks, yeah.
It's just the thought of your stats are quite impressive in like the overall numbers, you know?
Yeah, it's a lot.
And I'm just sitting here thinking about, you know, ways that we've become more efficient in my own workplace, you know, and PHA now has gone to Epic, which they've acquired, I guess, through Yale now, right?
Yeah.
So I wonder if there's an avenue there to free up some of your nurses' time, which is record keeping, if they can build a template into Epic to send the school physical forms directly over to.
Wouldn't that be amazing?
Yeah, so we've done it with like our
Look
nursing
at
home, kind of
that.
like the W-10 transportation.
Yeah.
We started doing those through Epic now.
Yeah.
And it's worked so much better.
The system he was talking about at the beginning, there is an actual EHR for school nurses called SNAP. It's used in, I think, 90% of the schools in Fairfield, in Connecticut. It's made by nurses for nurses. It's very template driven, easy charting. frees up a lot of time, and you don't have to do so much of these stats, because you can query
You
it
just
much
get
more
them out,
easily and
yeah,
run a lot
make
more
it for you.
reports.
Yeah.
And we've talked to Epic over the years, and there was a collaborative of health departments that were trying to get access into the Epic, because there was some willingness on the part of Yale to connect health departments, and then when the numbers came out of how much it would cost, none of the health departments could afford it, and Yale was not willing to cover the cost of that, and so it just became, too much for us,
It's interesting though, like CT Wiz is a life changer, and Snap syncs the CT Wiz, so you just automatically upload, just pulls everybody's immunizations. That in itself saves a lot of time, but the ability to access the kid's physical or something like that would be fantastic.
Yeah, I mean,
It's half of what we're doing all summer, is tracking.
for
Right.
pre-K, part of there's got to be a way for them to build it in. Their Epic designer should be able to build in a way to electronically send that to you in some
Yeah.
way. It's definitely done in other avenues for similar types of state mandated forms,
Yeah.
So, just something to maybe consider a conversation on.
Yeah, I mean, once if we get SNAP and we get involved, maybe it's an enhancement we can seek, I'm sure somebody's thought of it.
Yeah.
I mean, it would be nice if each pediatrician could send over prescription chains
Oh.
directly to you
Yeah.
guys,
Right.
right? And little things like that, where I'm sure it's, I get it begins,
Yeah,
how
versus the
complicated-
paper,
how complicated it must be to track, like, the dosages and,
yeah,
the students who take, I'm sure there are a lot of kids who have chronic
yes,
medication.
yeah.
You store, you keep it all there.
yeah.
I mean, I imagine if SNAP is that big and Epic is that big, they probably have conversations somewhere. There's
You would
probably
think.
pretty good interoperability there already.
Yeah.
Yeah.
Cool. Any other questions, Sarah?
It was a good year, though. This
Yeah.
one, year 2 is so much smoother. Looking forward to next year.
I'm shocked at the number of visits.
It's so many.
I would have guessed.
I'm not shocked.
No, I'm not.
Yeah,
I mean,
as a parent,
Yeah, I know. My son loves the school nurse, so he's there all the time.
Yeah, before I was a school nurse, I would have sworn, no, my kids would never have gone to the doctor, or the nurse's office. And then I remember I was working at one of their schools, and I, looked, I was like, every kid doesn't feel, and so many of the times the nurse takes care of what they needed and goes back to school, and, that moment is just sort of, never known it even happened, Like the win-win, they came into the nurse's office, the nurse, whether it was something they gave them, helped them, rested, whatever,
Said a kind word.
said
Yeah.
something
healed.
nice, yeah,
I'm impressed how few phone calls I get
yeah,
from Jeanette Buckley. She rarely calls.
yeah.
She just handles it and sends it right back.
And she is real busy. She's at a 17
Yeah.
visits per student school.
I can see that.
Yeah.
I mean,
It's hard.
here we are at field day last month, right? And I'm helping out at field day, and my son
Don't
apparently
get
telling her
started
to
on
me,
field day.
and I see him running off, I'm there, and he's not coming to me, can you all find her? Where are you going? Get that out there, no.
Yeah,
Fine.
we tried to provide every school with an extra nurse on field day, because that is a 50, 60 visit
Jason,
day.
just so you're aware, our malpractice insurance doesn't cover you on that.
Just so you're aware, fair enough.
Thank you.
Great report.
Thank you, yeah, that's amazing.
Any communications this month?
We have none?
Any old business?
None?
Any new business?
None?
Do we have a motion to adjourn? All right, any opposed? Hearing none, we adjourn at 8:15.
All right. Well, thank you, everybody, for
Thank you.
getting us to that quorum. Thanks, Sally. See ya.